Good morning. Thanks as always to Jay and Vicki for interpreting. So we're going to go straight to the numbers. So in Hamilton County, we have 61,931 positive cases of COVID-19 throughout the pandemic. 2,275 of those individuals have been hospitalized, and we have lost 441 people to COVID-19 in Hamilton County. So those are pretty staggering numbers when you think about it. But I want to just say a little something about today. I mean, it's Inauguration Day. So it is a day for transition. It is a day for celebration. But as the president-elect noted with the vice president-elect last night, we are at a very solemn time in this country, given the nature of this pandemic and the fact that it has taken over 400,000 lives nationally. So I think it's a day with mixed emotions. We are celebrating a transition, as we always do every 4 years, but we have a lot to think about related to this pandemic and where we have been and where we are heading as a community. Also, as many of you I'm sure know, Hamilton County for the first time ever is in purple. This is a designation that the governor uses to talk about the severity of spread in a community. Throughout this pandemic, we have never been purple. We have bumped up against it, but we never have been in purple. We are now. That happened last week on Thursday. And so what does that mean? And I've said this a number of times. It means whatever the governor says it means. It's his designation. But what he has said to date is that it is the most severe and the most alarming level for any county to be in, meaning that the spread is very high and we need to take precautions as a community to tamp down the spread of COVID-19 in Hamilton County. So as we feared, there was a spike after the holidays. We appear to be coming down a little bit from that spike, but we did see a spike. People let their guards down, unfortunately, in some cases, not everybody. Many people kept a distance, celebrated virtually, did things very differently this year, but others got together in small groups in homes. I've heard a number of anecdotal stories related to that, and many, if not all of the individuals that were in that home got sick, and some of them got very, very severely sick and were hospitalized. So the advice remains the same: stay distant, wear a mask, and wash your hands. The one new piece triggered by the purple designation, and it's not so new to us in Hamilton County, it's stay home. Go out when you need supplies or services. Otherwise, stay home. It's this idea of reducing your COVID footprint that we have talked about in the past. Think about interacting as little as possible with other people outside your home or outside your bubble. So let's talk vaccine real quick. Greg's going to focus on this quite a bit. We did have a press conference on Friday, rolled out a website that I'll talk about in a second. But let's talk about where we are. So we've got this calendar that we're going to put up, and it shows the current timeline for the rollout of eligibility for the vaccine. Now, I want to be very clear. As we talked last week, there's been this disconnect between the federal government, the state government, and local governments. So just because you are eligible, unfortunately, does not mean you're going to receive a dose of vaccine in Hamilton County, because we're not getting enough doses to allow for these populations to be vaccinated, even though they're eligible. All right, so as you look at this calendar, and it is it makes my eyes glaze over a little bit, so many lines, but you can see the eligibility for 80-year-olds. And then the next week, 80-year-olds and 75-year-olds become eligible. And then the next week, we add 70-year-olds, 75-year-olds, and 80-year-olds are eligible. And you can see the progression as we have lines, increase there as we go through the map. That is the current state of affairs. We are not getting enough doses to accomplish this. We are trying desperately, though, to get people information and get people signed up that are eligible so that we are vaccinating as many people as possible. And we are doing that, and Greg's going to elaborate on that. I did hear Governor DeWine say that given this reality, that the doses don't match the eligibility, he may think about delaying some of those eligibility groups. Don't know. It talks about who's eligible and outlines that. It also provides a menu of providers that are distributing the vaccine and getting people signed up to get the vaccine. So an individual can go on there and choose one of the hospital systems, choose city public health, county public health, or one of the Kroger little clinic sites to sign up to get vaccinated. So the choice is theirs. They can sign up for more than one if they so choose. But it is meant to help people navigate. So you go to one site and then you have the options in front of you. And then you click on those and you go to get signed up. If people don't have access to the internet, and especially seniors who sometimes are not comfortable with the internet, call 211. That is the hotline that's been set up. The United Way was very gracious, and they are staffing that hotline. They have received over 2,000 calls as of today, and that was primarily over the weekend and yesterday. So call 211. They are very happy to talk you through how you get signed up, and so I would highly recommend that. The stories I'm hearing out of that hotline are rather heartwarming, really, where people are getting connected. Seniors that have a lot of anxiety about this are getting connected and getting signed up. So thank you so much to the folks that are staffing that hotline. So lastly, we have some really good news today by way of a partnership that has been forged. So Hamilton County Public Health has been looking for a common place to distribute the vaccine to those that are eligible. Those that sign up on their website and are in the queue will now all go to primarily go to a common place, and that place is the Board of Elections site in Norwood. It is centrally located. It is on bus routes. It's set up like that because it's a voting site, right? So it's as accessible as it can be. And we purchased, or rather are leasing, extra space there because we needed it for early vote. We are now using that extra space to accommodate vaccine distribution for public health. It is a tremendous partnership between the Board of Elections, Public Health, and the County Commission. And I'm delighted that this is coming online. We do have Sally Crystal and Sherry Poland from the Board of Elections, the deputy and chair of the Board of Elections, to talk through that partnership and what that's going to look like and kind of the logistics of that site. They are the experts, and they're with us this morning. So we'll get to them in a second. So Greg, I'm going to turn to you. One last thing. Greg and I have shared a number of emails to one another about eligibility for the vaccine. I just want to be very clear on this point because I get a lot of questions about this, and I know that Greg does too. The eligibility criteria are being set by the governor and the medical experts at the state level. We are obligated to follow that criteria, to follow that priority system. And so it's related to age right now. And so we don't have the flexibility to say, we in Hamilton County are going to do this differently. We are following the state's criteria. So I just want to be clear on this point because I think there is some confusion. And so if people do need to understand better that eligibility, and when you are eligible for the vaccine, go to testandprotectcincy.com. The information's there, or go to the state website, coronavirus, and you can find that eligibility information. All right, I'm going to turn it over to Greg.
Good morning, and thank you, Commissioner. Our team continues to work on contact tracing and vaccine efforts. While we know vaccine provides hope, I do think it's really important to remember that there remains a lot of COVID-19 within our community. Commissioner Driehaus just shared a reminder that we are in purple this week. We are guaranteed to be in purple this Thursday because of the nature of how the system is set up. We'll be there for 2 weeks. Some of the numbers do seem to be improving a little bit, and I'll run through those here in a second. But please, please, please remember to do your part to lower your COVID footprint. When you're out and about, please wear your mask. please social distance, please wash your hands or sanitize your hands frequently, and even most importantly, if you're sick in any way, shape, or form, please stay home. So I'd like to start by looking at some of the data. Our last peak was 1 week ago on January 14th. Over the last week, the number of cases in Hamilton County have continued to decline. The past 7-day average was 346 cases per day. For reference, last week we were at 569 cases per day, and just a short time ago on December 10th at our highest peak, we were at 716 cases per day. So we are looking much better than we did just a month ago, and I think that's very promising. We continue to see a lot of COVID activity, though. We have over 10,000 known cases of COVID within our community at this current moment in time. So one more reason why we turn purple, and one more reason why to remember when you're out and about to make sure that you're careful and you're doing your part to protect your family, your friends, and those within our community. Very closely tied to cases is our reproductive number, and you just heard me say that we have seen a decrease in the number of cases in Hamilton County. So our reproductive number ties to that. It's 0.93 this morning, and for the region we are at 0.90. So that means if things continue, we'll start to see some contraction of this pandemic within our county. Our hospitalizations, which are for the county on the top graph, continue to decline as well. We are at around 5 hospitalizations per day over the last couple weeks. These continue to trend in a downward direction. Other good news is when you look at our regional hospitalizations, they still remain extremely elevated, but over the last couple months, they've been around 700 people in the hospital systems per day. This morning, it's around 660 patients in our regional hospitalizations. This number still is high, and this still putting our hospitals in strain, but it's much of an improvement, so we're very excited about that. The same is happening with our intensive care units. I have been reporting for quite some time that we've been around 200 people in our ICUs. We are now down to about 175, so they're still also strained, but that number is starting to come down slightly. Turning over to some of our vaccine effort, I wanted to reiterate that from the beginning, we know that vaccine is in limited supply, and our office is doing the best it can to quickly turn those doses into patients, making sure that we're getting it into arms quickly. We are just now starting our 4th week of vaccinations. Public health is. Hospital systems have been doing so for about 5 weeks. So it's really easy to lose sight that even though we've been talking about vaccine for a long time, we're just starting to push the 1-month mark. So quite a lot has been accomplished, and I'm very proud of all of those that have contributed to this effort. Since the rollout has been kind of slow, the number of doses, public health is averaging about 500 per week. We know that it will take some time to get to you. So I continue to urge individuals to be to be patient as we work on this. Last week we shared that Hamilton County Public Health is just one of 48 providers in Hamilton County that are delivering 8,100 doses to 80-year-olds. To the best of my knowledge, nearly every provider quickly filled up with anxious 80-year-olds who were 80 and above who were excited to get this opportunity to get vaccinated. My team, we used our registration list for our 500 doses. We used our registration list and actually called those individuals that were on the list. And I can tell you, my team was so excited to make that call, and each 80-year-old that we talked to was so excited to have this opportunity to get vaccinated. We talked to many daughters and sons that were helping their older parents out, and it was really a nice opportunity for some of my contact tracers to make these calls and to have some very positive stories. So I'm excited that we're able to make this work happen. We are actually today and tomorrow vaccinating 500 individuals in Forest Park. These are once again the 80 years old and older. So next week, as Commissioner Driehaus indicated, we will begin the work of vaccinating those that are 75 and above. If you are 80 and have not gotten vaccinated, we're asking you not to worry. You are still eligible to receive your vaccine. We are not going to leave you behind, but as mentioned, our doses are limited. We would encourage everyone to register on our website, as well as the other partners that are receiving vaccine, which can be found on our website and the Test and Protect Cincy website referenced by Commissioner Driehaus. In conclusion, I just want to one more time remind folks, while we are in the middle of being purple and still in the middle of this pandemic, please continue to mask, social distance, and wash your hands. This is how we'll keep our seniors and our population healthy until we can get vaccine for everyone who wants it. Thank you.
Thanks, Greg. Okay, I want to now turn it over to Sherry Poland and Sally Crissell. Sherry is the Director of Elections. Sally is the Deputy Director of Elections. Thank you so much for being with us this morning to talk through a little bit of the logistics related to the site at the Board of Elections that's going to be used for vaccine distribution. So welcome, ladies.
Thank you. Thank you for having us this morning. Sally and I, as well as our board members, are extremely excited to be able to partner with the commissioners and with the Public Health Department to provide a facility to administer the vaccine to the public. The facility that we'll be using was used as the early vote center back in the presidential election, and that space served us so well. It's over 15,000 square feet, so there's plenty of space for the Public Health Department to administer the vaccine, to be able to stay with the social distancing, just like we did with early voting. And 80,000 residents of Hamilton County voted early here at the Board of Elections. So we already have 80,000 that have an idea of where the facility is. We are located in Norwood, just off the Norwood Lateral. The address to the early vote center, where the vaccine will be administered, is 2300 Wall Street. We have close to 100 free public parking spaces. And as you mentioned, we are on several bus routes that stop very close to the facility. We will have the appropriate signage up. So once the person gets to the campus, we'll have signage up directing the person to the new Public Health Department's facility on our site. So again, we're really excited. We've also been able to share other resources, things like iPads and the appropriate tables, chairs, those little things that, again, it's a shared resources, what helps with the overall budget of the county. So, we're happy to have this partnership.
We also we wanted to participate in any way that we could, because Greg Kesterman was very helpful to us when we were trying to figure out how we were setting up our polling places for last November in terms of the booths, et cetera, when we needed to figure out how we were going to make them work for social distancing. So this is kind of a way to help pay back some of the help he gave us early on. So we're really pleased to work with his staff on this.
Greg's smiling over on the other side of the room. Good karma, I think, right, with this partnership. So thank you so much for describing the location. The idea is that as we ramp up and hopefully see more vaccine and those eligible, we do this in a higher volume, we've got a facility that can accommodate that. So it's really this great partnership with BOE, Board of Health, County Commissioners. So anyway, thank you for being willing to do that, and kudos to all of the above for reaching out to one another to make this happen. So, Bridget, with that, I think we're ready for questions.
Thanks, Commissioner. Up first, Ann Sanker with the Inquirer has questions for you, Greg.
Although Denise can stop there for a moment if she can. Well, at any rate, either one of you. My first question is, do we have an idea of when you may open this facility at the Board of Elections, or is this just you've got it now, and when the doses arrive, you've got the place to get folks to come through?
It's going to open on Friday.
Friday. Okay.
Yeah.
Sorry,
we didn't mention that.
Yeah. And who's going to go Friday to get vaccinated there?
So it's by appointment. So remember, folks are getting signed up through the 211 or through the website. And so they get signed up for an appointment, and then by appointment, people come to the Board of Elections and get the vaccine. I didn't mean to have any misunderstanding. Please do not just show up at the Board of Elections and expect to get vaccinated. It doesn't work like that. You have to have an appointment.
Okay. And this will be where this week's 500 dose allocation will be distributed from the Public Health Department.
I'm going to turn it over to Greg.
So 500 doses are actually being distributed today and tomorrow in Forest Park. We received at some point last week notification we would have 200 more doses for those that are 80 and above, and those 200 doses will be distributed out at the Board of Elections on Friday. All of those appointments actually were made via phone call. We called people, and all 700 appointments this week were quickly filled up by anxious and excited 80-year-olds.
Did you have any refusals?
We actually did have individuals when we reached out to them that already had another appointment. And so we were excited. We're happy that people are finding appointments elsewhere as well. And we have had a few people cancel appointments because they found a sooner appointment that they accepted. So I would just urge everyone who is listening today that if you do get another appointment, please let our team know so that we can use that very valuable spot and get somebody else vaccinated.
Okay. One more. Thank you for that, Greg. One more question. At the briefing last week, when you were discussing the case counts and the hospitalization counts and death counts, I did not pick up from you the sense that we were going to turn purple the next day. Were you concerned about that then, or did that come as a surprise as well?
So I did reference that a few of our numbers were in the upward trend. The dashboard did kind of show that we were heading in that direction. Overall, though, we as a county with some of our hospitalization numbers have not increased significantly, but over 5-day periods, if you were to go to coronavirus.ohio.com's website and look, there are several metrics that have just slight increases over 5-day periods. Where we look today and where we'll look tomorrow is much better than we looked last Thursday. But that I cautiously say that as there is still significant COVID-19 within our community.
And okay, thank you very much.
You're welcome.
Thanks. Next up, we have Corey Sharber with WVXU, and he has questions for you, Commissioner Kesterman.
Good morning, Corey.
Morning, Greg. I just wanted to, I don't know if this was mentioned already. Could you give the number for the new weekly cases?
Commissioner Driehaus has that number.
Yeah, it just occurred to me that I didn't share that. So the increase from last week to this week related to positive cases is 3,428. The increase for hospitalizations is 41, and the increase for deaths is 15. As you can see, that's higher than usual. So yeah, that's that holiday bump that we just talked about.
Okay, I have some more questions for Greg. I just wanted to go over, sorry, I didn't mean to kick you off, Denise. Just had some more questions just relating to vaccinations. I know you guys have been talking about this during the briefing, but are you guys getting any indication from the state or federal level of more vaccines coming to the county? Because it seems like you guys are still at the same level of 500 each week.
We are consistently seeing about the same number as a state. I did look at the allocations for next week, so starting the 75-year folks and older, and Hamilton County last week for this week saw 8,100 doses. Next week we are anticipating as a county as a whole about 10,500 doses. So our county is seeing more doses next week to help with this effort.
And going back to the county being at purple, is it kind of caught everyone by surprise. Given the current trends of cases and hospitalizations, now while some are trending down, how long could the county remain purple? Are you guys making any, seeing any changes in the near future?
So the state dashboard has 7 metrics, and we are currently having 6 of the 7 metrics flagged, which makes us purple. To remove the purple status, you must have 5 or less metrics to go back to red, and you must stay that way for at least a week. So what I anticipate tomorrow when Governor DeWine gives his update at 2 p.m., Hamilton County will remain purple. We cannot turn backwards yet because we've not been with 5 metrics or less. The following week, if things continue to trend as they look today, we should transition back to red with high incidence of cases. So that's that marker that means that we have more than 100 cases per 100,000 in population.
Okay, thank you very much.
And that seems to conclude our questions from reporters.
Well, thank you. Thanks again. Happy Inauguration Day to everyone. I just want to give one anecdotal story related to 211, the hotline. So as Greg has said, these seniors who are 80 years old and over are thrilled to get signed up to get a vaccine. It's such a relief to them and their families. And so these 211 operators, some of them were contact tracers, Contact tracers have a really hard job because they have to let people know that they have been exposed to the virus and now need to go on lockdown. And so that's not always a pleasant conversation with people. And they don't necessarily want to hear that news. These same people are now staffing the 211. These seniors and their families are so excited about getting this vaccination. They're having long conversations with the folks staffing the line. They're calling them angels. They're thanking them over and over again for their service. And so I just wanted to say one more time to the United Way and the folks staffing those lines, thank you, thank you, thank you for doing the work. And thank you to the community at large for being patient as we continue to roll out this effort. So with that, thanks again to Jay and Vicki, and we will see you next week.